I regret not having a Kleenex box near me because I'm just getting emotional hearing this because this is the reason why we wanted to do this. And in December, when that Time magazine, when that Time magazine came out, I was like, oh no, Hav. I'm like, Pete's getting too popular for us. He's not going to want to talk to us. but there really hasn't been any accolades you've received that you haven't uplifted all the team members that have been helping you out. Could you talk a little bit more about what, the collaboration between the Utah Navajo Health System and the collaboration that's, continued to go between you two?
Well, the Utah Navajo Health System employs me. It started back in February. Actually, I was a contractor here. I was a multimedia contractor. I did a lot of media work here at the time being. And last February, I actually left UNHS. I tell this story all the time. I left on a Thursday. Then I was hired Tuesday. I was rehired Tuesday. Yeah, because February came and I had plans. I had bought tickets to travel the world for 3 months.
Wow.
So I left here. I left on a Thursday. I was like, yeah, because like I was a contractor. I wasn't an employee. I was a contractor, independent contractor. And I left and I was like, yeah, I'll see you guys later. And then COVID came and they stopped all flights at that time.
Mm-hmm.
They canceled my plans. So the people here that I worked with, they called me and they're like, you know what? Why don't you come back on Monday? Let's have a talk. So that Monday is in February. That Monday I came back. They offered me a position here. It took some back and forth because I wasn't really sure I wanted to be here for that long. I didn't know how long I was going to be here. I wasn't convinced yet. But I told them I would consider it. I said, you know what? I'll do the job until you guys find somebody. And so the next day we had a meeting because we had 2 possible positive coronavirus citizens here on the Navajo Nation in Monument Valley. And so I said, hey man, we should start a program because it's not a question of, if it'll get here, it's when it's going to get here. And the Navajo Nation's already set up to fail, like infrastructure-wise, health infrastructure, economy, it's not set up for. So in our minds here at the clinic, we were thinking like, this is going to be like the plague. This is going to be like smallpox, and are we ready for that in this day and age? No, we're not. We can barely handle diabetes on the reservation.
Wow.
And so that's how it started. UNHS started me off, giving me money every week to start, stockpiling non-perishable food items, like canned food and stuff like that, water. Then I just started calling people like, hey man, can you help me out with some water or some, it's just different things. It just started snowballing after that. And there's a lot of people that want to work with me in some way in any aspect. So I started reaching out to them and they're like, you're starting a program, And I was like, yeah, I want to start a program. So UNHS had my back since the beginning and it still continues on to this day. I mean, we've gone beyond the COVID program. We've gone beyond the firewood program. We're starting the arts community back up, which I started by bringing in some mural artists to us, murals, and we have a whole series I have the whole series laid out for these artists to do for the rest of the year for our buildings here, and we're just keep building upon that, and we're still rolling. And UNHS has become more than just a health facility; it's become like a community beacon because because one of our biggest issues and one of the things we try to push around here is mental health.
Mm-hmm.
Mental health is something that's not really talked about on the reservation, and it's something that should be addressed. And that's how we're moving in that direction because it's not, people think coming to the clinic just for something physical, like you get hurt, you break a bone, or you're feeling sick. Right. But no, you can come to the clinic to talk about your problems if you have something. I have some series in the works about bringing in Because, like sexual assault is huge on the reservation. A lot of sexual assault and, a lot of men and women who've been sexually abused. I want to give them a space to where you can talk about it, bring in experts, people who've been working in this field for years to come in and talk to people, to the community, and say, it's okay if it's not okay that it happened to you, but it's okay to talk about it. It's okay to let it off your chest, and get it off your mind. And I think that's how we can break that cycle of abuse in the home, is the saying, stop. Tell me what's really bothering you. What's really your problem? What's the real problem here? And hopefully we can get all that rolling soon. I mean, COVID's really highlighted a lot of this because a lot of people had to stay home. And one thing that COVID really showed people is that leaders come from anywhere. There's people that popped up that never thought they'd be doing what they did to supply for their community, and it lies within all of us. And hopefully, man, it was a very confusing time, because we were also, at the same time we're dealing with this pandemic, we're also dealing with the presidency that wasn't helping anything.
Yeah.
And it's just the political side of it really crippled everything.